To that, she works with individuals and couples to alleviate distress related to grief and loss, as well as wide range of mental health challenges, including anxiety, depression, stress, emotional issues. Dr. Mahmoodi has diverse clinical and diagnostic expertise and utilizes a range of effective intervention to approach these issues. Alhamdulillah, she completed her PhD in clinical psychology from California. Her clinical training includes working with refugees and torture survivors, veterans, and many individuals. So alhamdulillah, we are blessed and honored to have you tonight. So without further ado, I ask Dr. Venus to please come and join us and enlighten us, inshallah. Jazakumullah khair. Yeah, is that okay? This was actually set up for a wedding before.
Oh, mashallah. Oh, mashallah.
Okay, so two things, loss and find. Oh, can I keep it? Sure. So number two, if you need help in babysitting, we have that available as well, inshallah. So if you need help with your children, inshallah, right next door, inshallah, you can find out from our ICLI team, and they will be able to help you, inshallah, with your children as well. Jazakumullah khair. This doesn't have anything, so we'll combine these two things.
Okay. Can everybody hear me? Yes? Okay. Bismillah ar-Rahman ar-Rahim. So I'm not used to sitting up and talking to people. I'm a teacher, and I like to walk around, but I don't have a PowerPoint like I typically do. So bear with me. Hopefully this will be as entertaining as it is for my students, inshallah. So let me introduce myself a little bit so that you have a sense of what I do. I run the Khalil Center here in New York. I also am a clinical psychologist, which basically means that I see teenagers, I see women, I see men, I see couples who are really struggling. And what we're going to discuss today is not going to just cover what I see. We're going to cover what you might experience in day-to-day life. When those day-to-day life experiences become more challenging and more overwhelming, that's when I see people, right? It gets to that point where it's I can't handle this on my own. So typically, we're going through these day-to-day kind of hustles that I'm sure that everyone's yeah, totally. That's what we're going to be talking about. And this is actually, a workshop that happens, full day, but we're going to try to cover as much as we can so you get a taste of what we're trying to accomplish. And next, I want to tell you a little bit about the Khalil Center, because I think we do such amazing work. It's one of the largest providers of Muslim mental health in North America. And after we opened up an office in Toronto, we get to say North America. And so we started off in Chicago. There are 3 offices there, and then the Bay Area, where I'm originally from. And they were just about getting started when I moved to New York to finish up my PhD. We opened up the New York City office in July of 2018. We've been there about a year and a half. We're looking to expand and see more patients. And essentially, we're working towards prevention, education, and treatment, and integrating both Islamically important concepts into the treatment. So all of the clinicians working at the Khalil Center are trained in modern psychological techniques, like cognitive behavioral therapy and all kinds of things. But then the really unique part of our work is that we also integrate that with Islam. And sometimes it's even using Islamic interventions. And we have a religious consultant who happens to be my husband. And we will consult on cases together, especially if there's a religious component. Like yesterday, a question about divorce came up, and it was a very fiqhy, question. I was like, this is not my area of expertise. So we got him on the phone, and he consulted on the case. So this is kind of the model that we focus on, so that we can support Muslims in particular, because Muslims want Islamically integrated psychotherapy. They want the religion integrated into the work. And this is the reason that a lot of times we end up not wanting to go see a psychologist or a therapist because it's like, they don't understand what's going on with us. They don't understand. And believe me, as a psychologist, I have to go to therapy. It's part of my training. It's just what I have to do. And I've been to terrible therapists, like really terrible therapists. One woman's like, so where are you from? And I'm like, California? And she's like, no, where are you really from? Afghanistan? And then she's like, are you a citizen? And I was like, lady, wait. In the age of ICE, you do not ask this question. You do not ask this question. And I said, thank you very much. I'm never seeing you again. So it's really important to know what works for us, and we're trying to, meet that need of taking care of people where they're at. So we're really trying to help people and meeting them. Oh, excuse me. Okay. Meeting them where they're at. So, one of the reasons that we often want to do workshops like this is because we want to address stigma. Because in our communities, there's a lot of stigma associated with mental well-being. Whether it's, that person's crazy. I tell my patients, don't use that word in my room. Don't use that word in my office. It's not helpful. When you call someone crazy, or when you call yourself crazy, it means there's something seriously wrong with you, and you're just not right. But the thing is, we're all struggling. So it's really important for us to acknowledge that it's a struggle, and oftentimes it's something that can be treated. So we have to be really mindful of that. We're worried about what other people think. We're worried about what we're going to think of ourselves. So we're really mindful of managing the stigma by saying, listen, this is a necessity for all of us. Even a psychologist, even children, even adults. So our hope is to destigmatize mental well-being, mental health treatment, so that you all have opportunities for mental well-being. So one of the things that I was thinking about is why do we talk about stress management? Well, because in the US in particular, I'm sure this is the case around the world, Muslims are under a lot of stress, right? So both, through our daily lives, like work and kids and school and all these different things, but also there's a lot of racism and discrimination, right? So there's a whole host of reasons for us to be feeling overwhelmed and stressed. It makes sense. And also 18% of American Muslims experience anxiety. Anxiety being the clinical level of stress, right? What is stress? Are you guys, do you guys participate? Is that something you do? What is stress and what is anxiety? Yeah.
Stress is when you feel very much pressure, you have to do something.
Okay.
And anxiety is when you're very scared or worried about doing something that you have to do.
Wow, really great. Yeah, so stress is something that you're worried about that you have to do. And then anxiety is something where you're feeling scared. Yeah, kind of. But good try. So stress is essentially the daily hassles, right? It's not one particular thing. It's just the daily stuff that we have to work through that can get overwhelming. And anxiety is more specific. That's the biggest difference, right? I'm anxious about the test tomorrow. I'm anxious about, whether my boss is going to fire me. Whereas stress is like, oh, okay, I got to wake up in the morning and handle life. So we don't, it's not necessary to know the difference between the two. They're very much overlap, and we use them interchangeably. So what is, if we jump into detail, what is stress? Well, essentially it's the body's reaction to certain triggers. There's certain things that bring some kind of a reaction to us, right? So for example, if you have an exam tomorrow, what happens, right? You start feeling like the heart rate, you start feeling like, oh man, I better study, oh, I'm so dumb, what's wrong with me, right? We have all these different types of symptoms that come up for us when we have, or, oh man, we have guests tomorrow, so we have to clean the house, like, all of a sudden we're feeling overwhelmed, yes, and the moms are like, yes. Yeah, so there's a variety of reasons why we might feel anxious or overwhelmed or stressed. And so there's also a wide range, right? So we have kind of transient stress, right? You have the exam's over, you're good, right? And then there's chronic stress, when there's issues within the marriage, right? It's like this constant worry, like, oh, okay, how are we gonna have a fight again? Oh, how do we manage this? And then we have, more acute, intense stress, right? Like when you're in a war zone, right? It's really intense, it's constant, and it's not good for the system, right? The body at some point needs to like readjust how it deals with it because it's so intense and so chronic. So if we were to, compare a roller coaster, say you're someone who's like, yeah, I'm going to go on a roller coaster. So you go, you get on, get in line, you're about to go, and all of a sudden you feel it in your body, right? The heart rate goes up and you're like, and the thrill, you go through the whole thing and afterwards you're like, oh, okay, now it's done, right? So you don't feel those things anymore. Divorce, this is something that is highly stressful. It's one of the highest stress-inducing things that can happen in a family, right? Because kids are involved, and the husband, wife, everybody's struggling. So it's really important, but it's still finite, right? It's really important to manage it, but it's finite. At some point, people work through it, they get over it, they're able to feel better. And then war, which is a lot more chronic, right? So especially those of us coming from countries that there's war and there's refugees, and it actually impacts generations to come. I was never in a war zone, but I have pretty intense anxiety at times because it was something that was passed down to me. So it's really important for us to be mindful of not just what's happening in the here and now, but our histories and also our parents and grandparents and what they went through. So what often happens is that stress turns on our body's alarm system, right? So we have this, if this was your brain, right? This is the prefrontal cortex. This is the part of the brain we want working all the time, right? It helps us plan events. It helps us figure out what we need to do, how we do it, right? It really helps us with all the kind of day-to-day activities that you have planned for yourself or things that you need to get done. But deep inside, right, we have the amygdala. And the amygdala is the part of the brain that says, you know what? Nope, none of that can happen because you're scared and something bad's going to happen. It doesn't know what that bad thing is. It just says something bad's going to happen and you better watch out. And so when that alarm goes off, the captain of the ship, which is the prefrontal cortex, can't do anything. So think about a time that you've been really stressed. Can you really think about like how to fix your stress? Can you think about okay, I'm going to just like stop and come up with a plan? No, it's a lot harder. It's way harder to do that. So that's part of what we want to kind of discuss today is how do we figure out like, oh wait, this is stressful. Let me stop and manage this a little bit better. So what happens when the alarm system goes off, our body releases this hormone called cortisol. And cortisol manages our stress. But the thing is that if we have a really high level of stress for a really long time, you're just going to have more and more cortisol. And so those, sometimes people are like, oh, I just feel like my belly's just getting a little chubbier. I'm like, yeah, because you're stressed out. Like, what? Stress does it? Yeah. You might not be eating extra. You might not be doing, anything. You might be exercising. But cortisol is really bad for you. So if we don't manage our stress, we have these high levels of cortisol that is going to impact your mental well-being and your physical well-being. So the types of stress that we encounter are the acute one, right? This is what leads us into this fight or flight mode where the alarm goes off. And eventually, once that danger is gone, we're okay. So think about, a gazelle in the savannah kind of hopping along, and then the cheetah comes, right, starts racing towards it. It either fights the cheetah, which we never see, of course, or it runs away, right? And most of the time it runs away. So that's fight or flight, right? But sometimes we're in this fight or flight mode when there is no danger. That's what I mean by this amygdala being kind of like not knowing what the danger is, but it just kind of goes off. So that's acute stress. Chronic stress is something that's ongoing, constant, nonstop. And what happens is that if it doesn't get managed, it's going to lead to serious health problems. So acute stress we want to manage, chronic stress we want to manage. And then we have normal stress. Normal stress? That's so weird. Like, what do you mean normal stress? Well, think about an exam, right? An exam is something that's important. right? Especially if you're in college or you're in school, you need to do well on the exam. And so it's okay to have a certain level of stress to help motivate you to study. And then once the exam is over, then you're like, okay, now I'm okay. So we have to have a normal level of stress because that pushes us forward and we get the things we need to get done. Okay? And then there's distress. And distress is when we're in a state of despair and it's really hard to manage. The stressors that we experience are really hard to manage. Okay? So what are some common stressors that we encounter? Well, personal, so, whether we're feeling ill, right? Our kids are misbehaving and we don't know how to manage them. Finances, marriage issues, divorce, getting married, right? The actual, it's like, hey, that's a happy occasion. Yes, it is definitely a happy occasion, but it also comes with a major life transition. And so major life transitions are often very stressful for us, whether they're good things or more challenging things. Work changes, right? You get a new job, you have a boss that's really challenging to deal with. And environmental changes, right? I mean, we're in this place in the world right now where global warming is a serious issue. My family's from California and they couldn't open windows for months, because there was such bad smoke in the air. They couldn't see the sky because it was so dark all the time. So, all of this impacts us, right? Feeling worried about the coronavirus, right? So all of these things are stressors, but how we manage them is going to tell us how it's going to affect us long term. And so the symptoms of stress are going to be, can be categorized into physical symptoms, cognitive symptoms, and emotional symptoms. So when we have physical symptoms of stress, we're not going to be taking these nice deep breaths, right? This is part of my work. I'm like, all right, take a deep breath. And people go, I'm like, no, right? It's really hard to take that nice deep cleansing breath. Often there's muscle tension. Have you noticed that usually the neck and shoulders, right, they feel really tense? Yeah, that's stress. You can't relax, you feel tired, your immune system kind of functioning goes down, so you get sick more often. Weight fluctuations, some people gain weight during stress, some people lose weight during stress. They may not, their diet may not have changed, but there is going to be changes in their weight. Medical issues, higher blood pressure, higher heart rate. And also, some people crave sugar during times of high stress. So when people crave sugar, they're eating this and it actually causes inflammation in the body, which is also really bad for the body, right? So next is the cognitive, right? So these are the types of things related to thinking and the brain. And so we have a harder time concentrating and focusing on the things we need to do. We're easily distracted. Often there's what we call cognitive distortions. And what we do is we say things like, oh, that always happens to me. Does it really always happen to you? No, it doesn't always happen to you. But it feels like it always happens to you. I never get chosen for a promotion. Is that really true? What's behind that? And then we just have a sense of helplessness, there's nothing I can do to change the situation. Or hopelessness, right? Emotional, people are often very irritable when they're feeling really stressed and anxious, really irritable. And this is what often causes family problems, right? Because one person's irritable and then the other person gets yelled at, and then it just causes more conflict within the home. Often a low mood, depression, anxiety, and feeling overwhelmed, right? Feeling like everything's on top of you. Socially, in terms of interactions and relationships, we see people becoming more intolerant of other people's behaviors. They often need they rely on others to kind of carry. I'm working with this family. I'm actually working with this man, and but there's this whole family issue that's coming up where he's constantly relying on other people to hold his stress. And I'm like, listen, you cannot constantly rely on other people to manage your stress for you. You have to manage it. You're a grown man. You can do this, right? With our kids, it's different. Kids, we can't rely on them to manage their own stress. right? That's why we have to manage our own stress first, and then we can manage our children. We can't expect them to be like expert managers of stress, because sometimes they can't identify what's going on for them. The other important factor to think about is the vulnerability to stress. So there are certain factors we need to take into consideration that help us understand if we are going to be at risk of really succumbing to stress. And what I mean by that is, how well are you sleeping at night? Do you eat properly? Do you eat nutritious foods? Right? It's fine, to eat certain, sweets and things like that. Fine, but are you getting enough nutrients? Because sometimes we could be eating, but are we getting the proper, vitamins and minerals to help us? Do you have someone to talk to, right? Or are you bottling things up? And how is your health? How is your well-being? So I have some sheets that I can give out. I only have a few copies, but I'm sure we can send other copies out of a test where you can see your vulnerability for stress, and it'll be helpful to see like, how vulnerable am I? I often look at people like, how well do you take care of your physical well-being? And often it's like, oh, I don't sleep at night. I'm like, okay, well, what's preventing you from sleeping at night? Well, I stay up all night worrying. I just sit there and I think. Okay, that's not healthy. That's not healthy. We got to manage those thoughts. Okay, so let's talk about managing and coping. We've talked about, I just told you that stress is going to manifest in physical ways, in cognitive ways, and in emotional ways. And so if we're going to manage stress, we also have to manage them within those different categories. So if we start off with physical or physiological, the first thing that I often do is I say, okay, when we worry and when we stress, we're not in the present moment. We're worrying about something in the future. Oh no, what if this happens? Oh no, what if that happens? This is going to happen, and then that's going to happen, and then I'm going to lose my job. Okay, hold on. Come back to the present. So the way I like to do this is say, okay, you can either touch something, like feel a material that's soft, feel a material that's rough, or even state where you're at. Okay, here we are in the basement of ICLI. Yes? Okay. On this Saturday night, right? You just state the obvious, right? My name is Venus. I'm sitting here with you all, mashallah, right? So stating the obvious. Sometimes when my patients get really overwhelmed by a story they're telling me, I said, let's stop for a moment. Let's just stop for a second. Where are you right now? It's like, I'm sitting with you. Yeah, where? Oh, in your office. Okay, what else? So then they start describing the space, like, oh, there's a TV screen right there, and there's a picture right there. So that's how you bring yourself to the present moment. Then you start checking. Check your breathing. How are you breathing? Are you doing... Or are you taking nice deep breaths, nice, calming breaths? How's your heart rate? Do you have a headache? Have you had food today? Have you drank water? Right? I'm like trying to drink this water, like, I'm thirsty. So checking in with yourself. If you have a dry mouth, you're thirsty. But sometimes when we're so overwhelmed by our stress, we don't pay attention to that, and we're not able to take care of that need. And then we end up getting headaches. That's my classic problem. I always forget to drink water. And then I come home like, oh, I have a headache. So, and one of the most important parts of the physical well-being is sleep, right? We all have a set number of hours that allow us to feel restful. So for some people that's 6 hours, for some people it's 7 hours, for some people, I have some people coming in and saying, I need 10 hours of sleep. I'm like, okay, if that's what gives you that restfulness, fine. So how are we going to make this happen? So this is where I often encourage people to do what we call sleep hygiene, and making sure you're not drinking a ton of water right before you go to sleep, making sure you're not exercising right before you go to sleep, making sure you're not eating right before you're going to sleep. So, and also doing a lot of calming exercises while you're in bed, right? Doing some nice breathing and doing a body scan, which is where you just check how you're feeling in every part of your body. And if we were to do a longer workshop, we could go through how to actually do that. So once people start sleeping better, they feel so much better. They will come in and say, oh my gosh, like I slept this week. I'm like, alhamdulillah. So next is diet. Often when inflammation has a huge factor in our mental well-being. And there's a whole group of psychiatrists called functional psychiatrists who do not prescribe medication, but they prescribe food. They prescribe certain types of food that will help manage your mental well-being, right? So if we are deficient in certain vitamins and certain minerals, the likelihood of experiencing stress and having that stress feel really intense and overwhelming is much higher, right? So some of these minerals actually and vitamins help us manage our mental well-being. So some of these being, vitamin D, omega-3 fatty acids, and other types of important nutrients. The other thing is exercise. I live in Manhattan, so I don't actually go to the gym. But then one day, I was like, you know what? I am just going to walk extra, and I ended up walking 13 miles. Don't ask me how. Don't ask me why. It just happened. But it's something that I know that when I walk more, it makes me feel better. And this particular, little self-disclosure, this week for some reason was way more stressful for me than any other week this past month. So that was like a moment where I had to be like, what's going on with me? Why am I feeling more stressed? My sleep was completely off, right? And I don't think I walked as much as I typically do. So I made those changes, and it feels a little bit more manageable. Is the stress gone? No. And oftentimes, it's stuff like, what's wrong with you? You're so dumb. You did this, right? We talk really negatively to ourselves. Oh, you messed it up again. And so sometimes people come into sessions and actually say these things, and I'm like, ooh, that's so mean. Would you talk to your child like that? Would you talk to your loved ones like this? It's like, that's kind of mean. So what I often do is I say, let's figure out how to balance the way you're thinking. Okay, I made a mistake. It's just a mistake. It can be remedied. It's fine. Even if you've done even if you made the worst mistake in the world, it's a mistake, right? You made a mistake. What are you going to do to remedy it? What are you going to do to fix it? If it can't be fixed, it's okay. Take a breath and you'll figure it out. Right? It doesn't help to be in this constant state of stress and treat yourself really bad, and then you're going to go down the spiral. I call it the spiral of death, right? You just kind of go down the spiral where you feel worse and worse and worse. So let's put a stop to that spiral and say, okay, you made a mistake. Let's figure out what to do next. If the anxiety is really bad, you say, this is temporary, right? Allah has promised us after every difficulty comes 2 eases. Ease is going to come. We don't know when, but it's going to come. So this is temporary. Next is that Allah subhanahu wa ta'ala doesn't give us anything that we can't handle. And for some people it's really helpful, and for some people it's not. So decide for yourself whether it's helpful or not. And if it is, alhamdulillah, this is something that I'm going to learn to figure out and to manage. And I'm going to keep trying. When my daughter was about 4, she came to me and she's like, I need you to help me put on my pants. I'm like, no, I want you to try to put on your own pants. So she's like trying to put on, she goes, I can't do it. I'm like, all right, sit on the floor, put one leg in, then put the other leg in, then pull it up. And then she goes, look, I did it. I'm like, see? So we can't just say, I can't, right? These are automatic thoughts that just pop into our brains, right? I can't do this, I can't go speak in front of a group of people. I can't do X, Y, Z, right? Instead of listening to that voice, just say, hold on, I'm just gonna try. I'm going to try to do this. So now this girl goes around saying, I'm going to try da-da-da-da. Because her mom's a psychologist and makes her think they say that all the time, right? So you want to instill that both in yourselves and your children so that they say, okay, this might be challenging, this might be difficult, but I'm going to try. So it's really important. The next kind of big piece is self-awareness. And this is the bulk of the work I do with people who don't have like depression, anxiety, trauma, but helping people figure out what's happening in their bodies. Because if you don't have self-awareness of what's happening in your body, you're not going to be able to manage your stress because you won't know when you're stressed or not. You might be like, oh, I'm feeling overwhelmed. Yeah, I'm sure you're feeling overwhelmed, but why? What's causing it? So oftentimes I ask people, how do you know when you're stressed? How do you know when you're overwhelmed? How do you know when you're feeling anxious? And the best one is, how do you know when you're angry? What does your anger look like? Oh, I don't know. That's the number one answer I get. I don't know. So, for us to have self-awareness, it really is important to be able to figure out when we feel these emotions and have these thoughts, so it doesn't get to that point of no return. It's kind of like the Hulk. You guys know the Hulk? Yes? Okay. So, right, it starts very slowly. It starts with the eyes turning green, and then the skin turning green, right? And then it blows up into, right? Once he's a big dude walking out Hulk smash, right? People can't, like, there's nothing that can stop him, right? And so what do people do? They shoot him with, like, tanks and stuff, right? And what happens? Does he, like, shrink down? No, he gets bigger, right? He gets bigger and bigger and bigger. So when we get into the rage, there's no stopping it. You have to just go into a corner, go into a separate room, close the door, and then calm down. But if we have enough self-awareness to be like, I'm kind of annoyed. I kind of feel annoyed that this thing just happened. I'm kind of feeling frustrated. Then you can actually do something about it. Then you can actually engage with it and say, okay, I'm feeling angry. I need to manage this before it gets into that rage mode. So think about the consequences of experiencing constant stress, right? So say you have increased stress in your job. It's more so than it typically is. And then you have a boss that expects some really, expects you to meet some deadlines right away. Like, okay, this, even though it typically takes you a week, you have to finish this the next day, right? So this person is probably experiencing increased anxiety and feeling overwhelmed. And so as a result of that, what happens next? What happens when they get home? How are they treating their spouse? How are they treating their children? Right? So it reverberates, it keeps going to the next group of people, right? And so if this person, this parent, this spouse has enough self-awareness, they're going to be like, you know what? I'm feeling really stressed right now. I got to do something to manage my stress before I get home. And this was me during my internship. So during the PhD, the very last year of a clinical psychology PhD, you do a predoctoral internship, which is like our residency year. It's the final year, and then you're done. And I used to work from 8 to 8 at various points, 8 in the morning till 8 at night. And there were times I would get home, I would be going home, I'd be like, oh, I hope my child is sleeping. Just because I was so tired and so stressed out. And I was working with traumatized children, so it was really, really overwhelming. And so I got to a point where I'm like, this isn't right as a parent. It's not right to wish your child sleeping so that you don't have to, so you can relax. So I had that self-awareness. And then I decided to make a change. I said, you know what? I'm going to take the 45 minutes it takes me from the hospital to my apartment. I'm going to take that 45 minutes and take care of myself. I'm going to listen to podcasts that I like. I'm going to do some deep breathing. I'm going to read. I'm going to do things that help me calm down. And it became a very different experience. I got home and she'd be awake and like, yay, we get to play now. It was really exciting, even though it was late. The next day you have to do the whole thing over. But it was manageable. So that's what was really helpful. And then the next part is emotional. And we talked about this a little bit, about emotions being on a spectrum. But essentially, this is something that I often like to dive really deep into. And we can't do that tonight, but I really enjoy talking about emotion regulation and being able to manage our emotions effectively, so that we're able to also connect with people in an effective way. The next kind of really important point is perception. If you and I have the same exact stressor, our perceptions are going to determine whether it's overwhelming or not. For me, it might be overwhelming. I'd be like, oh, I can't handle this. But for you, it might be like, no, this is easy peasy. What are you talking about? So our perceptions about various stressors plays a significant role in how we manage them. So if you see something as really stressful and overwhelming, like, I can't handle this, then yeah, it's going to feel that way. But if you're someone who says, okay, this is really overwhelming, I can't handle this, okay, let me stop, let me take a breath, let me figure out what I can do. Let me consult someone, let me talk to someone, let me figure this out. That often plays a very different role. So let's go through the pointers, because I feel like my time is diminishing slowly. So what are some concrete strategies you can take away tonight? The first is managing your expectations. When we have high expectations, we often get disappointed and then we feel bad. So this is like, being able to say no. This is, because we're like, we can do everything. I can handle everything. I can do the event at the masjid, and I can go cook for this person. I can do it all. Sure, you can do it all. But what's the consequence? How do you feel after? Right? How do you feel? Do you feel like, yay, I'm ready to go? Or do you feel, ugh, I don't want to do this again? Right? So be mindful about being able to say no to things that are not going to benefit, you emotionally. Because you might be able to do, out of the 5 things you've committed to, if you do 2 of them or 3 of them really well, you're going to come out of it feeling really good, rather than feeling stressed and overwhelmed. And then you're more likely to do more and more and more. And think about situations. Sometimes situations can't be changed, but if they can, how might you be able to change it? What might you do to change the situation, right? How are you going to manage your emotions around a particular thing? How are you going to make conscious choices? This is often what I really, push my patients. You have to make conscious choices. When you yelled at that person while you were angry, is that something you really wanted to do? I was like, no, I didn't want to yell. I said, okay, that wasn't a conscious choice. What we want to do as Muslims, because we want to hold ourselves accountable, is we want to make conscious choices. And so that's part of, if a situation can be managed and changed, what are the conscious choices we're going to make to manage that situation? Adapt to the stressor, right? Reframe the problem. One of the things about challenges is that it's a process. It's not this or this, right? It's not you have a problem and then you don't. Oftentimes problems, we have to conceptualize them as a process. It takes time to manage them. It takes time to handle them. It takes time to get them fixed. So if you see it as a process and you make smaller goals within that process, you're going to feel a lot more rooted. And look at the big picture. Like, ultimately, what do I want to be doing? When you start a PhD, you're like, oh my gosh, this is going to take like 6-7 years. Whoa, what am I thinking? But what they do is they give us very concrete goals. You complete the first year, you take an exam. You complete the second year, you take an exam, right? So they kind of help you manage it a little bit better. So then at some point you're like, oh, I'm almost done, right? Which is helpful. Acceptance. Some things have to just be accepted. We can't make, I live in a tiny apartment. That's not how that's not what I was used to growing up. I'm from California. We have, like the suburbs, right? You have a nice big house. I'm accepting it. It's annoying, but I'm accepting it. And we have to learn to forgive, right? Sometimes we want people to change. Like, I want this person to change. I'm like, well, can you control them? Can you control this person and can you change them? No, you can't. You can't change other people. You can tell someone, like, I would like you to, treat me like this, or you can do that. But you cannot control other people. So it's really important to be mindful that if someone is not able to meet an expectation, is it a realistic expectation? And is it something that you can let go and forgive? Schedule downtime. Incorporate pleasant activities in your life that are going to give you 5-10 minutes. I know you're all very busy. It's really hard to do this, but take advantage of transitional periods, right? The few minutes before the kids come from school, right? I often tell my patients go, I don't have any time to do mindfulness. I'm like, what about from my office down to the first floor? I'm on the 8th floor. That's plenty of time to do some, mindful walking, being in the moment. Take advantage. Or the walk from home to the train. There are opportunities. So we want to take a mental break. Even if you can't take an actual break from the problems that are in your lives, you can take a mental break. Think about something else, use a distraction, focus on something, whether it's a dhikr or a TV show or whatever it might be. There's no judgment. Whatever the distraction is, use it sparingly though, right? Not for everything. And then finally, having a healthy lifestyle, right? Managing your sleep, managing what you're eating, making sure you're drinking plenty of water, and making sure that you're working on your interpersonal relationships. That, if you're married, making sure your relationship with your spouse is good. If living with your parents, making sure your relationship with your parents is good, with your children. And if you start working on yourself, that's going to go throughout the house. People start noticing, and then they start making those changes too. Right? After someone works with me for about 6 months, they start speaking like me. And it's because when I'm in a therapeutic setting, I speak in a very specific way. And so what I want for my patients is to internalize what I'm saying so that they are changing the way they're thinking, right? And so if you start changing the way you're thinking and you manage your emotions, you're going to be able to, influence and be a really great role model for everybody else in the home. And that's all I have. Alhamdulillah.
I think we keep that mic for
Okay.
a few more minutes. Thank you so much, Dr. Ilyas, for being a part of this program. We're going to give you a few moments to ask questions. If you can take a few questions, I know the food is already served. You can, mashallah, smell the aroma already. But if there are any few questions or a couple of questions from both sides, is there anyone with questions? Are we okay with open questions? Okay.
Thanks, Salam.
What do you recommend as a psychologist is that when someone is in a state not able to handle the stress?
Can you repeat the last part?
What I'm saying is that what do you recommend as a psychologist if someone comes to a state that is not able to handle the stress?
He's coming to
If
this.
someone comes to a state that they're unable to handle their stress anymore, so what should that person do if they come to a state that they're unable to handle that stress that is upon them?
Okay, I'm sorry. I have really bad hearing, so jazakallah khair for bearing with me. Yes, and I think you're making a really great point. So what happens when somebody is at a point where stress is really overwhelming? That's when you reach out to the Khalil Center. No, that's essentially, that's the point at which you would reach out to a mental health professional. Because if you've tried all of these different tips and it's not working, then it's really important to say, okay, I've tried all these different things, it's not working on my own, I need a little help. And this is what we're trained in. We're trained in holding emotions. We're trained in helping you manage your thoughts, managing your lifestyle. So, we're here, alhamdulillah, to provide support. And there are other Muslim therapists out there that are, able to provide support, or if you choose to go to a non-Muslim. But that's definitely a point at which I would say, okay, now it's time to reach out to a mental health professional. Yeah, thanks.
Yes.
Oh, okay. Go ahead.
How do we teach children to be good managers of stress?
Okay. So I'm someone, whenever parents talk to me, I often, they're like, how do I manage my children? I'm like, okay, so what are you doing? So it's about you first and foremost as parents. How are you managing your stress? Once you have learned how to manage your stress effectively, then you can start helping your children manage stress. And what I mean by that is, this is a whole thing, this is a whole lesson, but essentially it's the way you talk about the stress. It's about the way that they making sure their basic needs are met, that they're sleeping adequately, they're eating adequately, and we also want to teach them resilience, right? So resilience is that, okay, you wanted to get 100% on that test and you got a 70. Okay, yeah, that I'm sure you feel really bad about that. But it's okay. Let's figure out how you can fix that for next time. So acknowledging what they're experiencing, validating them, and then helping them problem solve in a way where you're not freaking out on them. Like, oh my God, I can't believe you got a C. No, not helpful, parents. It just makes them feel bad. So being mindful about how you interact with them so that they're seeing like you as the best role model to manage their stress. If you can do it, they will be able to do it. So,
Okay, you have a question.
Because, I'm a clinician, I'm a pediatrician. Oh, sure. I deal with children all the time, and I face the problem with issues, and all those things. But talking to my colleagues and also my way. How far can you go? What are your limits when it comes to giving feedback? From Islamic perspective, how can we go in talking about it? Yeah.
About these issues, prevention issues. You have to be very careful about it. So that's my question for you.
So I'm a mental health clinician, right? I'm a clinician, and so I have to know what this is something that the Khalil Center, like our, Dr. Humayun Kashavarsi, who's our executive director, and Maulana Bilal, who's kind of like the board of directors and also a religious consultant. This is something that as an organization they've instilled is trying to find the balance between what our role is and what the religious consultant's role is. So I have to know what my level of Islamic knowledge is and what my work is around, what my understanding of the deen is. And then when I've found like where my stopping point is, that's when the religious consultant continues. So some people will come in and say, I want to be a better Muslim, I want to start praying more. And so yeah, that's something that I can help as a therapist by saying, okay, behavioral modification makes sense. Let's figure out how you can incorporate Fajr and how to make sure you're sleeping. But I'm not a spiritual guide, so I'm not trying to help them become a wali of Allah. That's not my role. That's the role of the sheikh. And so sometimes people will ask religiously kind of very specific fiqh questions or tasawwuf questions. That's outside of the scope, my scope of practice. So that's where the religious consultant comes in, and this, or I might say, you know what, I don't know, you need to talk to this person. So it's really, for us, it's finding the balance of what we're able to provide and what the kind of sheikh is going to provide. Oh, so within the legal, well, I mean, we are an Islamically integrated psychotherapy, this is where it's being developed. So ethically, we're still within the parameters of our ethical function, our ethical work. We're looking at symptom alleviation. So we don't have to only provide, we're not just providing spiritual guidance. That just happens to be a secondary part of what the mental health clinician does. So, our primary goal is alleviation of distress.
Any other questions? Yes. May I be next?
So in terms of, so I'll use myself as a little bit of an example in terms of work, right? How do you know when is it you in the situation you're not being able to manage it properly, or is it the actual situation that you're in, and that it's okay, might be time for a change?
I mean, I think they're kind of very well integrated, right? So it might be that you need to work on your resilience, right, to increase the amount of the ability to manage stress, but it can also be the situation. That's why I talk about self-awareness, that okay, how in a different situation, how are you able to manage stress? Are you able to manage stress at home? Right, I see baby in your arms, right? So it's how does that go? If that is okay, then it tells you that it's situational. So it's about managing, and then also knowing yourself, okay, in this situation I'm totally fine, but at work, okay, is it the work? Which parts of the work, right? I sometimes tell people to talk to it, okay, what part of work is really stressful for me? Which part of my daily life is most stressful, and how is it stressful? What is it bringing up for me? And so the more you kind of work with it, then you can kind of figure out if it's situational and okay, we need to figure out and get a new job, or if it's this can be managed. Let me try to manage my eating, my sleeping, all of these things yourself, And then once you've managed all of that and you're still struggling, then you can safely bet that it might be the situation more. Yeah.
We had a question.
Yes, I have a question. During your conversation, you talked about the sleeping technique, and I want to know some of the sleeping technique, except of the deep breathing, because I know in the bed, make deep breathing, and of course the one.
Yeah.
And another question, same. When you feel like a person feel like in a crosswalk, you know what to do, going from this major or not from this major, or what about if I don't want to succeed, start the school, and it's feel like starting the stress before make things happen.
So with regard to sleep, I would recommend looking up sleep hygiene, and you'll get all the different points. I might forget some, that's why I think it'll be easier to just look it up. But essentially, sleep hygiene is a way to help us prepare for optimum sleep. So this is where we make sure to, if for example you want to sleep at 10 o'clock, try to have your dinner by 6. Try to make sure you're drinking all your water by 6, so that you are able to use the bathroom, and you're not going to be awakened in the middle of the night to go use the bathroom. The other things are sometimes airflow. Sometimes when the rooms get stuffy, people tend to wake up. Some people prefer weighted blankets because it kind of makes it heavy, and they're able to kind of sleep better. And then also managing thoughts. So often one of the big issues is that we ruminate. And ruminate is these thoughts that come one after the other. And then we go like this. Oh my gosh, what if I can't sleep tonight? What if I wake up in the middle of the night and then I can't sleep? What if I start, dreaming about something really scary? And so all of a sudden it's like 2 a.m. and then you're looking at the clock and you're like, oh my gosh, it's 2 a.m. You know how many hours I have left? I have 6 hours to sleep. What's going to happen? Fajr is in So this is ruminating, and it is the worst thing when it comes to sleep. And this is where I encourage doing the mindfulness. So doing the deep breathing, and as you're doing deep breathing while you're lying in the bed, is focus 100% only on your breathing. Or you can even use a distraction. So sometimes people will name their top 10 favorite movies or astaghfirullah, this is masjid. But they go through a list of a certain list. Like you can go through your grocery list, you can go through something mundane and dumb, to kind of distract yourself from the worries that you're really worried about. Focus on something that's easy and doesn't have any emotional kind of connection. And so that often bores you, right? That's why people count sheep, right? It's boring, and then at some point, right, you fall asleep. But ruminating, that's kind of a big thing. And so with respect to what you were saying about the what ifs, what did the shaykh say, right? What if is from shaitan? Well, the psychologists say what if is from anxiety, right? And what if is not helpful? What if is about the future, right? And depression, I shouldn't have done this, I shouldn't have done that. That's from the past. So what we want to do is focus on the here and now. What am I doing right now in this moment to manage my problem, my goal, right? My goal is to go to college. Okay, what am I doing in this moment? What do I have control over? What can I do right now? And I'll worry about the future. So you have to talk to yourself in a very gentle, balanced way. So you instead of, oh, what's wrong with you? You're not going to get into college. No, not helpful. It's just the spiral is going to just keep going. So being mindful, engaging with it, and being gentle and kind.
Any other questions? Yes.
This
is the last one, inshallah. I know we're running late, so...
But nice and loud, because I can't hear.
Could you please stand up?
This is relative to managing expectations.
Okay.
And what it is. You can manage your own expectations on your own, but obviously when you're married, you're kind of managing each other's expectations.
Yeah.
That's all good and well. And then when you have children, that obviously increases the stress level naturally.
Yeah.
So my question to you is, when children naturally are going to increase your stress level, they're just because they're not emotionally mature, mentally, whatever. You're going to be there for 24/7. How do you manage your relationship at that point, because your relationship is changing?
With your kids?
No, with your wife.
With your wife.
Or with your wife, with your husband, because the nature of your relationship is different.
Yeah.
Do you like what men tend to do is when they're like what I tend to do is I like to just go in my corner and just like my quiet space, and I just like to shut down, or vice versa. Or my wife may want to have a different perspective. In that situation, can you just shed some light on that? Like, what's the is it just a period that you just have to get through? Because I mean, it's not easy. Or is there something that you can actually do on a day-to-day basis?
So I'm a perinatal psychologist, and one of the things that the research tells us is that once a couple has children, it's the highest level of like stress in the marriage, and also when they're teenagers. So at birth, yes, at birth to like 3, and then when they're teenagers. And the lowest levels of marital satisfaction happen during these 2 periods. So yes, what you're describing is not something I've heard many times, but essentially it's prior to having children, it's really important to make sure that the marital foundation is strong, because you can't expect kids to come and then, oh, we're gonna get closer. No, you're not. No, it's really hard. Because again, right, it's this unpredictable thing. Baby's gonna do what baby's gonna do. You're trying to like spend a nice evening, like, you know, together. No, it's not gonna happen the way that you expect, right? So, and then also the way that we decompress as humans differs. You know, my husband's an introvert. He is the biggest introvert I've ever met in my life. Okay, and I say this because he is, I hope he's not listening today, but he is a really big introvert, to the point where, you know, we'll go out, we'll come back, and you know, Manhattan's like really intense, right? He's like, all right, I need to like hide. I'm like, all right, introvert, go to your hiding space, close the door, I'll see you in a half an hour. So we know each other well enough to know what we both need for downtime. And so, okay, you take the kid while I do this. Okay, you take, right? Conversations have to happen. Open dialogue has to happen about, okay, having kids is stressful, but I also need downtime. You know, I decompress by taking time out. How much time do you need? Communicate that to each other, right? If wife wants time together, okay, decompress first, then go spend time with her, right? We each decompress in different ways. Extroverts, on the other hand, I'm in the middle. I'm not an extrovert either, but extroverts are like, hey, let's talk. Let's have a conversation. And it's like, oh, I don't, right? So let the introvert decompress first. Give them their time to kind of manage themselves and kind of replenish, and then have that, you know, together time, and make sure to schedule it. You know, moments of connectedness in the marriage are so important when you have kids and you're really stressed out, because if you don't have these moments of connectedness, it's going to feel like you're just roommates, you know. So make sure you have those moments where you're able to sit together and talk, but also taking care of each of your own needs as well.
One more? All right, I can't say that. One more?
Sure.
All right.
Mental health is such a subject that we are not really aware of until now. But many people doesn't want to think about this line, right?
Mm-hmm.
So if a person goes to work daily, doing fine at work, doing salah, doing fasting, and automatically they think that I'm fine. So we focus on the blood test report, not the sugar or the cholesterol. But if a person really has some issue and he doesn't recognize somebody else lives with him or close friend recognize and address that issue, and if the person is in denial, they don't accept it, or I cannot help this kind of what, how do you do?
Yeah, this is one of the most challenging things. Yeah, it's really it's really challenging when someone needs help and they don't know that, you know, there's a lack of insight. They don't know that they need help. So the issue is that we can't force people. So in psychology, we have a certain a way of approaching people. Like, some people just don't want help. They just don't want help, so they're not going to come into your office, or they come for one session like, this isn't helpful, and they never come again. So there's, we can't engage someone who doesn't want to help themselves. But then something happens, the more they get exposed to it, then they start saying, like, you know what, maybe I do need help. So that's why we do these types of events. That's why we try to, educate people about what it is that we provide. People will come into our, I've had multiple people come into my office, come once, disappear, because they're like, this isn't for me, you're not helping me, and then reappear. So we try to provide a really, comfortable, safe environment for someone to really express what's going on for them. And if they don't find us helpful, because people want things to get fixed right away, and it's just not the case in mental health.
People live with them, they really suffer.
They do, but the thing is, again, we can't force people, and so the family can encourage someone to go seek help, but we can't force. The hope is that they gain insight at some point and then they come back. And a lot of times they do, but not always.
Jazakallah khair. Thank you so much for the entire community. Dr. Venus, thank you so much for being here. We really benefited, and we hope that inshallah this will be a continuous program that we will be able to, that's fine, no problem, that we will be able to actually benefit from. I was speaking to Dr. Venus just before that she came in. I said, you know what? This is just an introduction. We are hoping from Allah subhanahu wa ta'ala that we will have a longer workshop, maybe 2 hours long, where we come in and inshallah sit down with her, and of course with expertise that she has, we will all learn and we will really benefit inshallah. A few important announcements inshallah before we have our sisters and mothers go and take the food. First and foremost, we have our Black History Month event tomorrow. It is the 17th annual event. It's going to be an amazing program with a lot of things to learn. It's tomorrow, inshallah, from 2 p.m. to 4 p.m. So kindly please join that program as well. Secondly, we have this amazing program. Sister Fawzia is here. She has the flyers. They're doing a program called Honor Our Heroes. Gambia is the only country in the world which actually stood up and spoke about the human rights issues that are happening in Rohingya Muslims. So regarding that, their ambassador will be coming here. This event is in March 20th. So if you can support this event, that will be a great event, inshallah. Also, as you know, that the tax season is coming closer. So I see a light. Brother Imran, are you here? The event is March 14th. March 14th, they're doing a program on tax grievances for the community. If you need help, inshallah, contact Brother Imran regarding that event. Regarding the events of honoring our heroes, Sister Fawzia, you're here, inshallah. You can always ask her and become a part and help them out, inshallah. And last but not least, inshallah, continuously keep yourself connected to the community, brothers and sisters. We need ourselves to be anchored to the house of Allah subhanahu wa ta'ala. May Allah subhanahu wa ta'ala accept, and thank you again for coming, inshallah. We'll ask our sisters to, inshallah, proceed first for the dinner. Brother, just give them a few moments. Once they are done, inshallah, then the brothers can go and take the food, inshallah. Jazakumullah khair.
I do.
Last brother Adnan Rogadia is here. Khalil Center. He'll give you all the information.
My daughter has a question for you, but she was too shy to ask it publicly.
Okay, tell me.
You can ask her.